Hello, everyone. Good evening, good afternoon to everyone around the globe. You're welcome to today's webinar, and we'll give at least 1 minute or two to allow more people to join before we kickstart the webinar. In the meantime, as we wait, yes, Zikilira, I see you are up to par with the protocol. Thank you for introducing yourself from Ghana. You can all take advantage of this opportunity and just drop your name, where you're from, so that we can familiarize ourselves with you, and also to brainstorm before we start the webinar today. We are planning to learn a lot about M&E, and I believe we can incorporate all these learnings that we get today into our projects or our businesses that we want to do. So in the meantime, please kindly introduce yourself in the chat box, and then we'll start in the next 1 minute. Thank you. Thank you for continuing to send in your introductions. Really appreciate it. Okay, we are 3 minutes into the hour. Maybe we can start with a few house rules, and then we do announcements before we start. If you have any questions throughout the academy, please just write them on the chat box and we'll respond to them at the end of the webinar. And just a polite reminder about the academy, about the pitch presentation. Guys, we have money on the loose. We have money awaiting for us. What do you think how do you think you'll impact your community? And what stands in between you and the impact that you want to do in the community? Is it money? If at all it is, then this is the right opportunity for you to do so. We have $500 to give. We have $300. We have $100 for the winning pitch competitions, pitch presentations. So start preparing now. Make sure you have the top-notch pitch presentation and you are preparing yourself well for the presentation. And $500, $300, and $100 is just waiting for you to win. Simple, very easy, ABC. And just to remind you, registration is on and it will close on the 25th of November at 11 p.m. East and Southern time. Please kindly don't be left out. We do not want to keep this money to ourselves. So we can start our webinar. I'll introduce myself. My name is Joyce Huku, and I'm the East Africa Regional Coordinator, and I'm based in Kenya. Today, we're going to learn about M&E. And we have our able presenter here who I'm going to introduce. We have Boaz Odawa. Boaz is a seasoned statistician and monitoring and evaluation expert with over 7 years of experience in data analysis, statistical reporting, and research methodologies, complemented by 6 years of hands-on experience in M&E. He holds a Bachelor of Science in Statistics from Jomo Kenyatta University of Agriculture and Technology, and is currently pursuing a Master's in Monitoring and Evaluation at the University of Nairobi. Boaz's commitment to excellence, strategic leadership, and multidisciplinary approach positions him in a highly valuable asset for any organization seeking to optimize its performance and achieve measurable outcomes through informed planning, monitoring, and evaluation strategies. Boaz, you're welcome, and you can go ahead.
Okay, thank you, Tim. Thank you, Joyce, Liz, and all members who have joined for this particular webinar. As you've been told, I'm Boaz Odawa, based in Kenya, and a statistician by practice, and equally monitoring evaluation expert by academia. I'd want to do my presentation in the next 40 minutes. Let me just share my screen, and you'll just have to confirm for me if you can see my screen.
Yes, boss, you can see your screen. Yes. You can go back.
Cool. I have to cool. I have to mention that I am really inspired by the Wales Mountain Initiative commitment, first on empowering young leaders, especially youths, to create transformative change in their countries and even in their communities. And today I look forward to dive into this week session on monitoring evaluation, something that I really have a lot of passion for, and complemented by my expertise and my skills in data analytics, data collection, data management, and also data analysis. We'll be covering fundamental and foundational concepts that will encompass also practical steps to enable us tease out insights on how we can use data, we can use M&E principles to drive change into some of the projects that we do. I hope this particular session will provide you with these actionable strategies, and looking forward to enable you apply these in your community work. Apart from that, I'd like to start by first introducing what M&E is, because our topic for today was on focusing more on how to effectively measure success and also to develop indicators for community-based organizations, CBOs. But before we look at how to measure success and to develop indicators for CBOs, we want to look at M&E in totality and ask ourselves what M&E is. And first of all, starting by introducing what M&E is, M&E encompasses two key words, M for monitoring and E for evaluation. And we need to, first of all, distinguish what these two words mean for us to enable us to appreciate how to utilize these particular principles in our day-to-day activities. So monitoring typically means to track, to continuously track. And in this particular case, we are tracking project activities, we are tracking project outputs, but also ensuring that as we track, we be guided by the objectives. So while doing a project proposal, there is always the objectives that we also need to look into. But before looking at those particular objectives, for us to achieve them, then we need to monitor them. So monitoring means that we continuously track these particular activities within a period of time. And these also involve a regular collection of data, a regular collection of data, a regular analysis of data, so that we can be able to measure performance. By continuously tracking these particular project activities within a period of time, then that's what we refer to monitoring. How about evaluation? Evaluation in this particular instance means to systematically assess. To evaluate also means to assess, and while assessing, we are assessing key project areas. One, we are looking at its effectiveness. How is this project responding to the initial objectives that were set? And two, we're also looking at the efficiency of that particular project that we're assessing. We want to know if this particular project has value for money. We want to look at the M&E principles that are being used in this particular project. We also want to look at the human capacity. We want to look at the financial capacity that have been channeled toward this particular project, and how adequate are they? Is there need to reinforce them? Is there a need to do an addition, or is there a need to have some reinforcement in different departments? Another thing is on impact. And while looking at impact, we are looking at specific areas whereby we look at sorry for that, whereby we look at we assess that particular project within a period of time. Let's say at the midpoint, if a project was 5 years, then the midpoint of that particular project might be 2.5 years, 2.5 years, or 3 years. Then we do an evaluation to see, we normally call it a midterm evaluation or a midline evaluation, to assess the project impact to the beneficiary needs. What are some of the surveyable changes? The impact can be either unintended or intended impacts that were noticeable during that particular period. And we'll talk about that in the subsequent slides. So here we focus more on the outcomes of that particular project, and we also look at the long-term benefits of the project. So that's the difference between how to monitor and how to evaluate. Apart from that, we also look at why is M&E important, especially for CBOs? Why is it important? One, if we monitor continuously and also assess project outcomes, we ensure that there is accountability to donors. There is accountability to beneficiaries and equally to the stakeholders. Let's first talk about beneficiaries. If a project is benefiting a certain group of people, there is need for us to pause at some point and ask ourselves, are we on the right track? And if we are on the right track, then we now need to do something called an evaluation and have an assessment to the beneficiaries using some tools that I'll talk about to see if there's been change from the baseline when the project was implemented to where the project is. To the stakeholders, when a project is implemented, a lot of stakeholders are involved. The community, you look at the local administrators, the government, the private sector, the NGO, and even the CBOs that are within that particular area. These stakeholders can be involved in this particular project either as collaborators, partners, or with synergistic moves. But we need to know whether this particular project, how has it been involving different stakeholders into its activities? And what are some of the areas that we need to work on or improve on to improve stakeholder collaboration? So it ensures accountability. It also helps in also tracking progress, as I talked about, towards the goals, and not only the goals, but identify areas of improvement, especially on the project objectives. Are we in line with the objectives? Maybe we add 3 key objectives that the project intended to cover or to meet, but we've only achieved 2 out of the 3. Why is the 3rd objective becoming is hard for us to achieve, or why are we not able to entirely achieve all the 3 objectives? By monitoring and evaluating the project, we are able to answer such questions. Another one is on demonstration of impact. And I talked about impact can either be intended or unintended. Some of them are expected, especially during the proposal stage, but some of them might not be intended. But this one is essential for us to secure continued funding, because we can't continue the project if it has no benefit, it has no impact to the project beneficiaries. Another one is on guiding decision making. Anywhere where data is involved, where data is collected, decisions has to be impacted. So we collect data to have information that can be able to, we can be able to tease out insights from them and assess project performance. We also use this to adjust strategies and also improve effectiveness of the projects throughout the implementation. If a project was 5 years, at year 1, we look at how the project is progressing. Either, let's say, the beneficiary need satisfaction of the project was at 10%. At year 2, it was at 30%. At year 3, it was at 60%. At year 4, it has reduced to 50%. We need to ask ourselves, why is it reducing? throughout the project period, or why is it increasing, and which areas do we need to improve on? There is differences between monitoring and evaluation, which you also need to know as part of the theoretical bit of it. When we monitor, it is an ongoing process. That's why in every project, there is always an M&E officer or an N&D manager, because while doing the monitoring process, there are tools that we use to monitor the project, and this one is an ongoing progress. We look at it on a daily basis. Two, there is also the evaluation aspect. This is conducted at specific times. We have the baseline when the project is just starting. We have the midterm evaluation at the midline point of the project, and also the end-term evaluation when now the project is now ending. We also focus on the activities and outputs. That's on the monitoring. Activities and outputs are things that are being implemented during that particular project period. Organization of sporting activities involving different beneficiary activities. But on evaluation, we focus on the outcomes. What are these activities and outputs that are being done by the project help in achieving our objectives? What are the noticeable impacts or outcomes that we can tease out from the activities and outputs that have been done by the project? While monitoring, we also track if the project is on schedule and also within the scope, but because it is an ongoing process, a continuous process. But while evaluating, we do it overall. Within 1 year period, how has the project overall achieved its objective? That is effectiveness. Within 2 year period, how has the project overall been relevant to the beneficiaries? And when we talk about relevance to the beneficiary, we look at the beneficiary needs. Before the project had started, what were some of the needs that the beneficiary wanted the project to solve? And as the project really solved them, if yes, to what extent? And if no, what should be done? Then monitoring helps make real-time adjustments because it's continuous. But while evaluating, we look at the insights for future projects and also strategic improvement. We evaluate at a certain period of time so that we can have a round discussion on what we need to be done within a particular period of time. Monitoring process is done frequently, either daily or weekly or monthly, depending on the schedule that the frequency that the M&D officer or you as a project officer you've relied on. But for evaluating, data collection is more of an in-depth but less frequent. It can be done after a year or after 2 years or after 5 years, depending on the funding and also when it was scheduled to start. Why is M&E important for CBOs? I had mentioned about its impact because the data that we collect helps CBOs in improving the community and also fulfilling their mission, because we have objective, we have the mission, the vision that we need to also be part and parcel of. And by doing this and also improving and also fulfilling this, we gain trust and continued support from donors. Two, on guiding program improvement, when we monitor on a daily basis, we can spot some of the problems early enough, take corrective actions early enough, and promptly identify areas of improvement, pain points that need to be addressed. And this helps us in overall reflecting some of the long-term success stories or areas that need to be improved for continued growth. Secure funding for donors and partners, yes, because there's several stakeholders that are involved in a project and are really looking forward to see whether the project is having an impact or not. Ensuring accountability, yes, because a project has different sets of beneficiaries and also stakeholders. That entail the key beneficiaries that can either be primary or secondary beneficiaries, donors, government, and that ensures that these resources are efficiently and appropriately used. Then we also learn a lot when we monitor and we also evaluate. We can get a lot of lessons that can be learned, a lot of best practices, success stories, tease out failures, and by evaluating these particular projects, these leads to us to plan well, make use of efficient resources, and even future program designs. What are some of the key concepts of measuring success? I've talked about monitoring, I've talked about evaluation. Why is it important for CBOs? But what are the key concepts on how to measure success. Now, on measuring success, especially for CBOs, success, when we talk about success for CBOs, what do we mean? By success, we mean that we've achieved our targets, we've achieved our mission, we've achieved the goal that was set, we've also achieved the project objectives. And if the project was serving the community well, then we are now able to serve the community. If a project was about a water project in the community because there's water shortage in the community, and now after doing a monitoring evaluation, we can successfully say that there's a reduction in the water turnaround time. If let's say an average household had to take an average of, let's say, 1 hour to 1 hour 30 minutes to access a water point. But now, being that there are several boreholes because of this particular project in the community, they can take less than 15 minutes, then that's a success. We've achieved one of our objectives, one of our targets, and one of our goals. So it goes beyond the financial stability, but we look at the social impact within the community. How is it empowering the community? How is it responding to the beneficiary needs? And that's where we talk about the project relevance. So what are the key areas that define success? One is achievement of objectives. And when you talk about achievement of objectives, here we are talking about effectiveness. Is the project effective? A project is deemed effective if the project has achieved its objectives. Here we are looking at the goals and the activities that were outlined in the project before, in the proposal of this particular project before it was being implemented. Have they been met? We say that a project has been successful if it has impacted the community positively. I talked about the positive impact and the negative impact. They can either be intended or unintended. And have they been impacting the community in the right way? That's why we talk about the positive impact. So these are measurable changes. We need to measure these changes in the target population, especially to the primary beneficiaries, looking at their economic status and the social condition. We ask them about the well-being. If we had a water in the community, how is it now affecting the well-being of the community? How about the children, the vulnerable members of the community? Children are able to go to school because they're not being sent to fetch water in the morning hours before they go to school. So they attend their classes, and that's an achievement, a positive impact. How about sustainability? Can this particular project continue beyond the funding of that particular project? And when we talk about the continual progress of the project, here we look at, is the community able to continue with the interventions that the project was championing for, even after the project has exited? That's where the sustainability aspect now comes in. So there are 3 key areas that define success. One is the effectiveness of the project in terms of achieving objectives. 2, impact. What impact is it having to the community? And 3, is it sustainable? So that if the project doesn't have funding, then we can be able to see some of the interventions that the project had already started the community going forward. Let's say about a project on kitchen gardening. People have been taught on how to do it, and they're continuing with that particular skill. The skill set that has been earned and gained from that particular project is continual. And that's how the sustainability aspect now comes in. So success has to be measurable in both quantitative and also observable qualitative. So we measure it quantitatively and we observe it qualitatively. Quantitatively using numbers and qualitatively using the stories. So what are the roles, the goals and the objective in shaping success? Goals are broad, they are long-term outcomes. At the end of that particular project, what do we need to gain or to achieve? So it's the overall impact. For example, to improve the access to education for children in rural areas. It's very broad. That's the goal of the project. We want to improve access to education. But what are the objectives? Objectives need to be smart. specific, actionable, measurable steps, and we need to achieve them. They should be achievable. Not only talking about them, good on paper, but can be achieved through actions. What do we need to do? We need to enroll 500 children in rural schools by the end of the year. It's not only access to education, but in rural schools. But how many children? 500. How about measuring by the end of the year? It's very specific and actionable. So these particular goals has to provide a direction and a focus. And this allows us to now easily measure their progress, easily monitor them, allocate resources and funds, and even adjust strategies when we evaluate them. As I talked about the SMART objectives for measuring specific, SMART means specific, measurable, achievable. They have to be realistic and also timely. When you talk about specific, for example, we want to increase literacy rates in the school. It is very broad. Instead, increase literacy rates of 300 children in the community by 10% in 12 months. It's very specific. How many children? 300 children. What is the percentage change? 10%. In which period? In 12 months. It's measurable. We ensure that we track progress through data and observations. And here, for example, how will you measure literacy rate improvement? Things to do with tests, reading assessments of these particular children. Achievable. We have to set objectives that are realistic, given the resources that we have also, and also the time that we have. In this particular case, we are enrolling 100 children. We're not enrolling 1,000 children, but 500, because we've looked at the context where we come from, and we've realized that 1,000 may be too ambitious, but 500 is attainable. Relevant. This objective has to align with the mission and the goals of that particular organization and what we need to achieve. So we ensure that the objective is directly related to the CBO's mission. Is our mission on wash, water, hygiene, and sanitation? Or is it on improving education? Is it on the health sector? We need to stick to our key area. It is time-bound. By which period of time and by which percentage increase? It should be SMART. So an example of a SMART objective here, because of the issue of time, by December 2025, we want to improve the reading levels of 300 children in community X, because we come from different setups and different countries, by 20% through weekly reading classes and assessments. From here, we can be able to identify the specific, how this particular objective is specific, is measurable by 20%, is achievable. We only target 300 children, is relevant, and is also time-bound by December 2025. We've set time for us to achieve this. We also want to, while measuring this particular success, there's something called indicators. And while looking at indicators, first of all, we want to ask ourselves, what are indicators? Indicators are SMART. By SMART, I mean they are specific and also measurable elements, and we use them to assess or evaluate the success of our project or programs. So for us to measure if a program or a project is successful, then we must have indicators. And we use these indicators to help us track whether these particular objectives have been met or not. The outcomes that were set have been achieved or not. So these are signals. They serve as pointers for project performance. And we use our data now to assess their effectiveness, the efficiency, the impact using the indicators. So if a CBO's goal is to improve community health, then an indicator might be the number of children who have been vaccinated. Or we can also look at the percentage reduction in the disease incidence, because the overall goal of that particular community was on improving health. We should also look at the type of indicators. And when looking at the type of indicators, there are different types of indicators. There are quantitative indicators, qualitative indicators, process indicators, there are output indicators, and even the outcome indicators. So quantitative indicators majorly deals with the numbers, and we can able to count them and measure them, like the percentage of children who have completed primary school in the village or in the community. We can literally count and work on that particular percentage. There are also the qualitative indicators, and this majorly captures on the opinion, the attitudes of the community members, or even their feelings, e.g. community members' perception on safety after installing street lights in the community. Are the safety improved or not? It's majorly on the perception, what they feel, and how they perceive it. Process indicators. Process indicators, from the word process, they are continuous in nature. And here we have to involve activities. You can't initiate an activity today, then measure its progress today. It has to take time. That's why we use process indicators to measure their impacts, like the number of training sessions conducted for health workers in a community. We can't train today, then we start measuring the number of health, the training sessions that have been conducted. But with time, after let's say 6 months, we need now to track and see how many training sessions have been conducted. Maybe they were being done weekly or bi-weekly or monthly. There are also the output indicators. These measure direct results of activities. For example, the number of women who received skills training. Then the outcome indicators, where you see outcome is majorly focusing on the objective. And outcome relates more with the impact. So here we look at the changes or the benefits that have resulted from the project, e.g. the percentage increase in the household income after training has been conducted. So if we first of all train, then after training, we give them time to implement some of the skills that have been gained from that particular training. Then later, we go and measure the impact. So they are outcome indicators. What are the characteristics of good indicators? So when you want to measure success, first of all, you have to have these particular indicators. One, they have to be specific, measurable, achievable, and relevant and time-bound, SMART. So instead of improving education, you can use increased primary school enrollment. Very specific. Because we can improve education by several means, maybe increasing the number of teachers in the school, but we don't want to do that. We want just to increase enrollment because maybe there have been dropouts in that particular community. Truancy rates, measurable. Here we use test scores to measure academic performance. Achievable. Are we aiming for 50% literacy rate or 30% or 80%? We go for something that we can easily achieve. Not easily achieve, but we can easily at least try to achieve it and measure progress. Relevant. How is that particular goal relevant to the community needs? That's why before a project is always being implemented, even before a baseline, we normally do a needs assessment. A needs assessment survey, and we call it a needs assessment survey. And for needs assessment survey, we try to look at the needs and assess the needs of the community before a project is being implemented. Are we really doing the right thing? Is it really the real problem in the locality, in the village, in the community? Before we implement that particular project, is it time bound? Should be a time frame for that particular project? While developing indicators for CBOs, one is I also gave a step-by-step process for creating meaningful indicators to make sure that we align. We first identify the goals and the objectives. I talked about that. We determine what needs to be measured based on the objective and the indicators of the objectives and also the activity that we need to implement. We set indicators that track progress and they need to be SMART, as I talked about that. Define data collection methods, which are data collection method we need to use, and this one will be informed by the indicators. If it's a quantitative indicator, then we need to do surveys. If they're qualitative indicators, then we need to use qualitative data collection methods. And now I'd like to talk about selecting key performance indicators, KPIs for CBOs. And KPIs is the most important indicators that track critical areas of the project. They are the striking indicators that needs to be assessed. They are very relevant to the community development, and here they can majorly focus on some of the needs of the community, especially on the education, needs especially on the health, and even on the community empowerment. I gave a case study on the indicator development for health CBO's project, and here my project goal was on improving maternal and health, child health in the rural community. My objectives were two. One was to increase the number of women attending prenatal care and also improve the access to skilled birth attendants. I had some indicators which were grouped. The one was on the quantitative indicator, the number of pregnant women who attend at least 4 prenatal visits. You can see how smart it is. And 2 was on the qualitative indicator, the percent of women who report satisfaction with the prenatal services, more on the perception. Then the process indicators, which was measuring the number of training sessions held for midwives. And lastly was on the outcome indicators, which was measuring the percentage reduction in the maternal mortality rates. These are the outcome indicators, now the universal one that now focuses more on the impact. After all these have been done, the activities, the training, and everything has been done. Now, what is now the outcome in terms of the reduction and the percentage reduction of the mortality rates? On this last part, I want to talk about data collection tools for M&E. And as I talked about this is defined by the indicators that we have. If we have quantitative indicators, we go with the surveys. So surveys are just questionnaires that we designed to collect qualitative and quantitative data for a group of people. So surveys, the sample size is always very large, and we use different sampling size formulas. If you have time, next time I can still talk about how to derive a sampling size for surveys on these, and how to ensure that it is statistical significance for analysis. And 2, a survey measures, for example, we can do a survey that measures community satisfaction with the health outreach program, whereby the program was part of the project, and it has been done for a certain period of time, that then we want to measure the satisfaction rate. So it's a satisfaction survey, sort of. Then 2 is interviews. These are one-on-one conversations that are detailed enough, and interviews involve one key informant interviews, one-on-one interview with only one key informant, somebody who is an expert in that particular field. There's also the focus group discussion and FGD, where you have a group of people that have a common area of interest, and now they want to talk about something. Let's say you have a group of youth and you want to talk about youth unemployment in the country. Here the advantage of it is that there's a deep exploration of individual experience and opinion, because you talk to people on one-on-one basis. There's a discussion that you also have with this particular people. There's also observation, where you use your eyes and you also record by just watching and recording activities that are being taken in real time. The good thing with this one is that it's very detailed, and the data is always very accurate. You can't miss on things. An example is you just observing children participation in after school tutoring session, or even children participating in a drama session, or even a sporting activity that has been organized by the CBO. Tools and software for managing M&E for CBOs. 1, we have Excel. We have to be very efficient in Excel. You can analyze data using collect data, manage data in Excel, analyze it, and even visualize it in Excel. It is easy to use, very available, and even good for small data sets. We have Kobo Collect, which is a mobile embedded data collection tool that enables real-time data collection, even in challenging environment. You can work offline, very customizable, and even ideal for CBOs in low resource areas. We can even also have a discussion on how to use mobile data collection application forms like Kobo Collect, SurveyMonkey. Google Form is also very easy to use. Magpie, Honor, and even Survey CTO to collect data real time. SPSS or Stata, these are now statistical data analysis tools, not for collecting data, but now analyzing data, even managing data. These are software that are some of them are more advanced for quantitative analysis. Now, the quantitative analysis that have been collected can now be transferred to SPSS or Stata for data analysis. The pros of it is that it handles large data and also support in-depth statistical analysis. We can do a descriptive analysis of this particular data and also an inferential analysis. information whereby we now need to correlate and see areas of improvement between age and this particular level of measure, or maybe an indicator parameter that we are measuring. We are measuring how do they relate, and what sort of inference can we derive from it. Then Power BI or Tableau, these are visualization tools that we use for reporting, and we can have a dashboard that we can use for it, especially for monitoring purposes, because it is continuous in nature. There are some ethical considerations of research that is also applicable to data collection and M&E, like informed consent. Yes, you have to always ensure that participants are fully informed for the purpose of collecting data, especially when collect data from the beneficiaries. Well-written verbal consent that explain why you are collecting data from them and why they have been selected to participate. Confidentiality, make sure that the identity and personal information is not shared anywhere, and they remain anonymous. Do no harm principle of research. Make sure that you do not negatively impact on the community. Do not use words that can either harm them psychologically or even physically. Cultural sensitivity, look at the culture, the customs, the traditions, the language that you use, and make sure that you also translate them into local language so that everybody is able to use them and they are culturally appropriate. Using M&D for decision making and reporting, yes, one, we analyze this data for insights. First, we have to clean data. When you've collected this particular data, you have to clean it to remove all the inconsistencies, the errors, the duplicates, and check the survey and make sure that there is no incomplete data. Make sure that after cleaning this data, you store it in a software like SPSS or Stata for quantitative analysis and qualitative analysis to generate insights from it. Then after doing the quantitative and qualitative analysis, now you can now identify gaps and areas of improvement by doing a report on that particular data. And now that calls for reporting on M&D findings and to the stakeholders. Tailor it to different audiences. We're now giving this data to the beneficiaries. Use a language that is simple to understand for the beneficiaries. When doing it to the government as stakeholders, use a language that can be used to the government. When presenting this data to funders, provide detailed analyzed data, infographic that can easily be funder specific. Use visuals that are appealing to the eye, charts and graphs that can be easy to understand and also more compelling. Present success stories by maybe doing case studies with the beneficiaries on how the project has impacted on them. I also talk about how to use M&E data to drive program improvement and secure funding. And here I talked initially about it on how to incorporate feedback, especially after doing assessments, how to demonstrate impact for future funding as part of the benefit of M&E, and aligning with the donor priorities by using the data to show how your CBO's works aligns with the donor goals and also the global development priorities. This also helps in building trust with the beneficiaries. There are some challenges and best practices in M&D for CBOs. This involves things like limited financial resources, yes, because many CBOs operate within a small budget, and this makes it difficult to allocate funds to improve, to fund proper M&D activities. There's also lack of skilled personnel. So you can have a project, yes, but you don't have an M&D officer, or maybe the skills that are needed to work on those particular analysis and also collect that particular data. Data collection difficulties, especially in different environments, reaching some communities in remote areas might not be that easy. There is also resistance to M&E because some staff members may see M&E as extra work or mistrust the process. But when we back this with the reliable data, that can be solved. There is also inconsistent monitoring systems, lack of standardized tools, especially on Power BI, like now Stata, on analyzing this particular data to make sure that you have the best. Best practices, you have to capacity build yourself by training on M&D skills, data collection, data management, data analysis, very important. Leverage on partnerships by collaborating with the different organizations, volunteers, different CBOs that can form partnership and also collaborate with you on the same. We also use simplifying M&D tools that are low cost, like Excel, and make use of Excel. Google Forms is also very cheap, free. Kobo Toolbox is also free, that can be used for M&D practices. Engage the community to make sure that they understand how that project is really of relevant to them, and also the first implementation. Start small and build up your M&D capacity over time. Leverage on the limited resources for effective M&D. Prioritize key indicators, which I talked about on the striking indicators. Also, use free or low-cost tools like Kobo Collect and also Google Forms and Excel that are free. Volunteer or student support, especially on collecting data, can also help you in saving a lot. Focus on data quality, not on the data quantity. Use a good sampling size, derive a good sampling that can be used. There's no need of collecting data for more than, if you have 10,000 people or as beneficiaries, data of 240 or 380 is enough for you to make good insights. Leverage on technology, especially on the Open Data Kit for WhatsApp to collect responses, and also on hard to reach areas to leverage on the resources and also on the technology to make sure that you make good use of the resources efficiently. Until that particular point, I've used approximately 45 minutes for, I think 45 minutes for this particular presentation. I'd like to stop from at this particular point and invite questions from teams, and I give it back to you, Joyce. Thank you very much for listening, and also I think you gained much from this particular discussion.
Thank you so much, Boaz. That was a very, very educative session. I really enjoyed from the word go. And I didn't want to stop you. It's unfortunate that you have finished, but I was really enjoying this. To the scholars, please, if you have any questions, you can drop them on the Q&A section, and Boaz will respond to them. And also would like to urge the scholar using iPhone to kindly introduce yourself in the chat box for recording purposes. And in the meantime, Boaz, as we are, is somebody speaking? Okay, it's your background, Boaz. In the meantime, as you are speaking, maybe I'd like to keep you up to par. With WMI, we provide seed grants and growth grants to students who have already graduated. We provide a seed grant of $1,000 and a growth grant of $5,000 to enable our scholars conduct meaningful projects within their community that are going to improve their community. And you've spoken the key words, you've touched the buttons that are very sensitive when we're writing this proposal. That is the SMART goals and the needs assessment. I liked how you really expounded on that, because those are the key areas that the reviewers normally look at when reviewing the applications. And you've talked about the needs assessment, the importance of having the needs assessment, because most of the scholars, they will write a project, but they will not conduct a needs assessment. Maybe if you can slightly, a little bit just expound more on why is it important to conduct a needs assessment, and also if there is need to like write the activities of whatever you want to do in that proposal so that the reviewer may understand. Speaking from a reviewer's point of view, and if you were to give somebody a funding for a project, what are the main things that you will look into when reviewing the proposal?
Let's take notes on that. Cool. Yeah, I've talked about and I think I hinted about needs assessment, especially before starting a project, because it's very important. When you talk about the relevance of a project, it is always being measured at the evaluation stage, especially the midline and the midline and the end term, and even the baseline. If a needs assessment has been done, one of the key things is that we implement a project with a focus on the beneficiaries. The broader goal of that particular project is to have an impact, is to be successful. And when you talk about success, we mentioned 3 areas. It has to be effective, has impact, and also sustainable. So we need to look at the community that we want to serve, the beneficiaries that we need to serve, and ask ourselves, what are some of their needs that has to be met, has to be addressed? And one of the most important crucial areas or reasons why we are having a needs assessment before a project has been implemented, one is to inform decision making. If we identify specific needs and gaps at the initial stage, and also identify these priorities at the onset by doing a needs assessment survey, we'll have data that will guide us strategically with the decisions and also help us in tailoring interventions for this particular project appropriately without us having to pause at some point and ask ourselves, are we on the right track? Or what are we addressing? Two, we need to optimize the resources, because when a project has been launched or implemented, there are resources that need to be implemented. So for us to allocate these resources appropriately, where are they most needed? The needs assessment survey will answer that. Another thing is on enhancing stakeholder engagement. We are not only working with a primary beneficiary, but there are different stakeholders that are involved in this. So when we conduct a survey that involves relevant stakeholders, we are able to ensure that the solutions are developed that will reflect the actual needs of these particular beneficiaries. And all the stakeholders have actually confirmed that this is indeed the needs that this particular community or beneficiaries need. If the government officials are saying that we have water problem in this particular community, the community themselves are saying that there is indeed a water problem. The chief or the local authority have even indicated that we have a water problem. Then by translating this data, we can be able to solve that particular need. We also have on establishing baseline data. At the baseline, we need to measure progress. Then we need to ask ourselves at the baseline, what is the current status? Against which we will be able now to measure impact and even measure progress after some 2, 3, 4 years going forward. Then we can also be able even to support and justify our funding activities and ask ourselves and say, yes, this was indeed the problem that we had, and through this particular funding, we are able now to solve it. So some of the last question was on the main areas that we look for in a proposal, especially when looking at it. One is how you define your objectives. Are the objectives very smart? And I've talked about the smart objectives. How are we going to, when doing a proposal, we also look at how are you going to even monitor this particular project over time. And here is where you are going to define your M&D framework. You are going to talk about a log frame, especially when having your M&D, where you define your activities, define your output areas, define the sum of the outcomes, and how you intend to impact on the community. I think on the interest of time, I'd like to stop it from there unless there's any other question. Thank you.
Thank you so much for that wonderful elaboration. And the doctors in the room are so happy because most of your case studies were in relation to medical, in health and all that. So maybe I want to ask a question in line with that. Let's say when you are conducting a project on your indicator is the number of women who received skills training. What are some of the sources that you can use to collect your data for monitoring and evaluation?
Some of the
sources, because when you're writing a monitoring and evaluation plan, you need to have an indicator and indicate where you're going to get this data from. So you have conducted a project on women who received, now you want to evaluate the number of women who received skills training. Where will you confirm, or what is the source that you can use? to get this
Yeah,
age?
Number of women who receive skill training, that's an indicator that we need now to measure going forward. One of the things that these people have received training already, and if they had received training already, then first of all, we have to look at the training. It means that there were some areas or some records that were being kept while these people are receiving trainings. We were monitoring them continuously. So now the aspect of a monitoring system has to come in before we even measure that particular indicator. So there was a training program record that has to be incorporated such that when now we are measuring the number of women who have received skills training, then you go back to the training program records and look at the records from that particular CBO to provide you with what were some of the skills that these people are being trained on and how many people have received that particular training. If it is a number of women that have received training, but you are doing it at the baseline level or at the skills needs assessment level, then you now go to the government or even the agency reports for that particular institution and look at it on the number of women who have received that particular training. Several NGOs and CBOs also have their own records that they keep for having that particular information. Different countries also have surveys that they've done and also reports, like the household, they have even the labor force survey reports that have been done that can be used to track that particular information. If it is now being tracked secondary, it is a secondary information. But if it's a primary information that within the house or within that particular CBO, then there's a training record that has to be kept in advance to be able to be tracked later. That's now the aspect of monitoring process indicator. Thank you.
Thank you so much. I have one more question in regards to observation. I don't know if it's embedded with anthropology. There's a very thin line between observation and intervention when you're using it as a method of data collection. How will you ensure that you will not intervene into whatever people are doing whenever you're using this as a mode of data collection?
Or between observation and intervention?
There's a very thin line. For instance, if you're maybe working in a health facility and you're observing how a health facility is providing services, and then in between your observation, a patient comes in and you say, let me support this patient. That already is intervention. So how do you prevent yourself from intervening when you're using observation as a mode of data collection?
When using observation as a mode of data collection, especially first of all, when collecting data, we have to stick to the ethics of research. And while sticking to the ethics of research, for example, we were collecting some data. Let me just use a practical example on patients with kidney failure. We are doing it here in Kenya for Kenya Renal Association. And we are using observation to collect data. You can ask a patient a question about something, but using observation, you can realize that this patient is either lying or saying the truth. So as part of ethics, especially on health, we are being cautioned not to intervene, especially because in data collection as ethics of research, the respondent is always right, and we need not to intervene to their responses. So when using observation, these are tools that we need not to intervene or question more. Observation is always easily used in instances where, let's say, you now need to, in a health facility, we want to see the number of CT scans in a level 4 hospital or a level 5 hospital. We can use observation. But when we want to delve deeper into the patient, let's say the patient level of improvement or the health-wise data, then we now need to resort into other methods of data collection, like have a key informant interview with the patient or a quick survey with the patient, and even a key informant interview with the doctor or the nurse in charge. Thank you.
Thank you so much, Boaz. So we have a question from Jose. He's asking, suppose you have already started your project, how do you handle situations where there is a lack of baseline data for monitoring?
There is lack of baseline data.
Yes, for monitoring, yeah.
Yeah, because most of the projects, you normally realize that the baseline is always at 0 in most of the project, unless you've done a needs assessment and maybe pointed out where it is at a certain level. But if you don't have a baseline data for monitoring, then your proposal has to be backed by secondary literature review or a desk research. Because you might be missing the primary baseline data, but you might have a retrospective baseline. One, you can interview different stakeholders within that particular framework. You can review historical records, let's say secondary information, just to estimate the situation before the project intervention has started. This will provide you roughly with a benchmark through which you may be less precise than the real baseline data might have helped you. Also use proxy indicators. There is in M&T there are proxy indicators whereby if a direct baseline data is not totally missing, then you identify an alternative, a relevant indicator that at least relates to it, that can provide you with an initial insight about that particular condition. For example, let's say we are using a regional or sectoral data as a proxy. It can help us in establishing maybe an approximate indicator. Let's say we are working in a Kenyan context, and it's a borderline, for example, between Busia and Uganda. You can use the Busia data to talk about Uganda because it is at the borderline. There are some regional data sets that can be used for us to now generate a certain indicator value to be used. You can also start with the current data as 0 as the baseline. You just assume 0 as your baseline and then start. Though it might be misleading, it is good to back it with secondary literature review. Or, but I'd go for just utilizing secondary data sources and also involving stakeholders that have been involved. There have been people who have been involved in that particular situation. If it is a problem with the health in the situation, there are health officers in that particular area that have been there for 5 years, 6 years, 3 or less. Ask them question about that particular situation that you have, even if you don't have measurable or quantitative values, but you have insight that can help you into answering some of the questions before you develop your proposal or you start your project. Back to you. Thank you.
Thank you so much, Boaz. That has been so insightful. And I can see here from the comments, the scholars are thanking you so much for the wonderful presentation. They've really learned a lot, I believe, and I wouldn't want to take any more of their time. Just want to appreciate everyone who joined today's webinar, and maybe just a reminder that the pitch presentation is open and registration closes on 25th of this month. Please make sure you register, because you will not be allowed to send in your pitch presentation if you have not registered. So please register for the pitch presentation and prepare yourself for delivering or submitting your pitch presentations. Boaz, if you have any closing remarks.
Team. Thank you so much. Mine is just to thank this particular team. I'm really glad to be part of this particular team today because one, this is a learning opportunity. This is a learning opportunity to me and even to all of us. And as I said before, I'm truly inspired by the team at West Mountain Initiative for the commitment on serving the youth, and especially on making sure that they drive change. Where I work as a performance insights analyst, and I work with youths across 18 countries to make sure that we plan, we train, we prepare them into life-changing careers after training them. And when working with these particular youths, I'd like to mention that this truly relates and correlates with whatever we have at our organization. And I believe that when working on your projects, this particular insight that you gain from this particular discussion will help you in improving on your projects, the knowledge gain in your academics, and even practically. I'll be glad to be part of this particular discussion even going forward, to even drive you more into deeper and deeper M&D and data insights, data collection tools, data analysis, and even now the in-depth monitoring evaluation frameworks, log frames, and even how to develop indicators going forward. Thank you very much, team. I'm so glad for being part of this particular discussion. Back to you, team members.
Thank you, Boaz. So scholars, if you have any questions for Boaz or if you want to connect with him one-on-one, please let us know and we'll share his details so that he may guide you in developing your M&A of your projects. Thank you guys so much for joining and you have a good evening. Bye. See you all next week.
Bye.